guys, what's up? Welcome to another episode of the NXTGEN podcast. I got my boy here, Dr. Nati Schnitman. He's currently a strength and conditioning coach and physical therapist at Monarch Athletic Club. He's a strength and conditioning coach over at Calabasas High School, and he trains patients privately at his individual practice, Schnitman Performance. What's up, brother? How you doing?
What's up, man? Thank you for having me here.
Yeah, man. Of course.
Grateful to share the space.
Yeah, man. And it's a beautiful space. So real quick, shout out to the D'Amelio family again. Thank you.
Thank you guys so much. This is
awesome.
Unreal.
Yeah. All right, so let's get started. We'll just jump right into it. So tell me, man, how'd you get here? Take me back, man. How did it all start?
How did it all start? Well, hey, you mentioned I work with Calabasas High School. Actually, born and raised in Southern California. Grew up in Calabasas, but it's funny, man. Like, a lot of people ask me where I'm from if I haven't met them yet, and low key, I'll tell them Woodland Hills. I got a lot of love for Calabasas, but
yeah.
You know, it's funny, man. Growing up in Calabasas, it was just a normal suburb, really. But now it's kind of, you know, there's a lot of celebrities and a lot of hype around it and whatnot. Yeah. But every time, you know, I say I'm from Calabasas, someone would be like, do you know the Kardashians?
Yeah.
And I'm like,
I was going to say, the Kardashians changed it all, huh?
Jeez, man. But no, it's... I got a lot of love for it. But yeah, no, born and raised in Calabasas and played soccer my whole life. That's pretty much really, really big part of my identity growing up. And played at a high level through the youth stages. Mm-hmm. Played at LA Galaxy Academy throughout high school, and then played Division I ball at UCLA and at Northwestern University. And we can dive into that a little bit more in that experience. And then after college... was at a little bit of a crossroads and actually found physical therapy and strength and conditioning, and kind of used both of those worlds to better impact people. And we can dive into that a little bit more today. But been working at Monarch Athletic Club, and then after undergrad, studied a few years to get some prerequisites and courses and under my belt, and went to graduate school at Franklin Pierce University, out in Arizona. Shout out to FPU. And I've been, after Franklin Pierce, I graduated, and I've been working as a physical therapist, as Nate mentioned, for 2 years now. It'll come in March, so at Monarch Athletic Club, and it's been amazing experience. So really, really grateful.
Yeah, man. Hell yeah. Tell me about just staying with, like, you know, getting up to this point, man. I remember you were at a place in, what was it, Minnesota? Was it called Training House?
Yeah, that was
Tell
a
me
cool.
about that real quick.
Yeah, Training House. So that was my third, or actually, sorry, it was my last clinical rotation in graduate school. Mm-hmm. It was my sports rotation, and that I felt for me I was very fortunate. I had all my clinical rotations I had in grad school. I gained a ton of value from, and I was really fortunate in that sense, but set up with a lot of really, really solid mentors. And Training House, for those who don't know, it's a solid outpatient orthopedic and sports facility out in Eagan, Minnesota, closely affiliated with the Minnesota Vikings. So you walk in, and it's like this mecca training performance gym. And was really fortunate to be mentored by Dr. Russell Linville. Shout out to Russ. Took me under his wing for 10 weeks in my sports rotation there. And there I saw a lot of post-surgical rehab as well as, conservative rehab for majority, I'd say high school, college, and some professional level athletes. And then learned a ton. But, I mean, I would be remiss to say that was the only valuable rotation I had. I had a lot of other really valuable clinical rotations during my time in grad school, all of which taught me different things. But the Training House was just, I mean, if anyone hasn't checked it out, especially in the athletics realm, it's a really, really solid facility. Yeah. It's cool.
Yeah, the reason I mentioned that is just because obviously you coming from there, like when I first met you, I was like really impressed. I was really impressed by you. We all were, but also after meeting just like another one or two people that came from Training House, everyone just seems to be like, it's coming out at such a high level. You know, you can just tell like the culture must be good, the mentorship must be good there. So.
Yeah, man, the clinical education there is top notch. I feel like to work at the training house, you have to have a super solid resume and a few years of experience under your belt, working with, like I said, really high level, high school, collegiate, professional athletes on a regular basis. And that rotation, man, was just so eye opening to me of how I dictate or how I go about my own practice clinically, but also professionally, working interdisciplinary wise. Like, I mean, that's why I felt Monarch was such a great fit after grad school, because I had a lot of reps under my belt working closely with a lot of the strength and conditioning staff at training house when, you know, me and my mentor were working with a patient, you know, post-op anterior capsule labor repair or, you know, post-op ACL. So I love the collaborative environment, and training house really gave that to me. And I learned a ton, you know, it was really cool.
Yeah, no, it's awesome, man. Well, since we're on the topic, man, how did you get into physical therapy? How did you get introduced to the industry?
So actually, funny enough, I got introduced by my sister. My sister, Jilly, she's a physical therapy assistant. Okay. She works down in San Diego at I forget the name of the hospital, actually. I'm totally blanking right now. Sharp Memorial. She works at Sharp Memorial. She works, you know, as a physical therapy assistant down there in the hospital. And, you know, pretty much going back after I graduated from Northwestern, I pretty much saw the writing on the wall that professional athletics wasn't going to be the path I was going to go down. And to be totally transparent, man, I was kind of dealing with a little bit of a episode of depression and anxiety just because soccer was my whole identity, my whole life. And to come to the conclusion that, like, hey, like, there's more than the sport was really hard for me to wrestle with at the time. And I remember it was after my fifth season, so I redshirted. So it was after my fifth season. I still had to finish up school and get my degree. And so there was this probably like awkward 6 to 7 month gap, you know, from the last game of season to me graduating. And I was like, shit, I just got to like stick this out until I graduate. So, you know, during that time, I was trying to figure out maybe what I wanted to do and just trying to finish my academic career, so to speak, at least undergrad. And the athletic trainer at Northwestern, rewind. First, my sister, we were talking on the phone. She's like, hey, you should look into physical therapy. I think it'd be something that you could actually be really interested in just because it deals with the human body and really helping people. And there's a lot of, obviously, as you know, like a lot of strength and conditioning principles involved, a lot of exercise. So I was like, oh, okay. Like, I didn't really know much about it, to be honest. Even as like a high level D1 athlete, like I didn't have much experience with it. It was kind of just like, oh, I have an injury. I'll rest and heal and do whatever the athletic trainer tells me to do. Right. But so then after that, I had that conversation with my sister. I went to the athletic trainer at Northwestern, and, you know, we were talking. His name was Chris Schenberger, great guy. And he was like, hey, you know, I know a physical therapist about 20 minutes away. She's really good. She works with some athletes if you want to just shadow her. And from there, it turned into, after class, I would go and just shadow just because I was interested. And after shadowing her name was Mary Kate Casey. I was watching her, you know, interact with patients of different ages and training backgrounds, and kind of a light bulb went off probably a month into it of like, wow, like this woman's helping a lot of people. I can do that. And a light bulb went off in terms of like, I'm so sorry. Like, let me rewind this. You're good. Pretty much what happened was a light bulb went off, and what happened was in my head, I had this inner dialogue that said, holy shit, I can do this and impact way more people as a physical therapist or something within this realm, and impact way more people doing this than I ever could as a professional athlete. Right. Because I kind of knew that like my athletic potential was probably at a cap at that point, and I was transparently pretty burnt out, you know, so I felt like it was a good avenue to go down and really apply myself. And also, you know, as you know, physical therapy and strength and conditioning, it's really a service profession. You know, I think a lot of the times maybe one of the reasons why my own career didn't come to fruition or never went to that next level, because I think it was so much ego driven, you know. And then looking into physical therapy, the light bulb, like I said, went off, and I was like, oh wow, I could really help a lot more people doing this. Yeah. And I love that. So I kind of dove deep into that, and then, you know, a few years of applying to schools and shadowing different people and working different places as an aide, and I really enjoyed it, and then after, got into Franklin Pierce in 2018, and it was funny, like I applied for 2 years. The first year I applied and didn't get in anywhere. So then that's when I went and got my CSCS, my strength and conditioning certification. I like ramped it up a notch because I was like, this is like what I need to be doing. And I remember the second application cycle, I got waitlisted from like 7 programs. Like, and it was just like, really? Like, in my opinion, like a waitlist was worse than a no. I was like, we're kind of into you, but we're not, Yeah. But I got waitlisted, and then Franklin Pierce, a private school in Arizona, took a chance on me, and they're like, yeah, we'd love to have you. And I remember like hugging my dad and like breaking down in tears. I was so happy. And from that moment, I was like, man, I'm going to like show that program and that institution like how grateful I am for that opportunity.
That's cool. And
for my parents, it was more of, I wanted to give them a return on their investment too. Yeah. So it was a really great process. And I can't say I loved every minute of PT school. It's pretty, it's a pretty aggressive academic run. It feels like you're drinking water from a fire hydrant in grad school, but it was all worth it, man. It was great. And just goes to show like everything happens for a reason, you know what I mean? Yeah. And, I couldn't be more grateful for that process, the good and the bad, so it was cool.
Yeah, man, that's great. In that story, I want to dive into something there.
Mm-hmm.
Just like, I mean, two-part question. I know you mentioned burning out in terms of like athletic wise.
Yep.
But tell me about like that time period of like what made you not want to take the next step? Because I'm sure you could have played overseas somewhere at some level.
Yeah.
And then B, after that decision being made, like what was the transition like, mentally?
Yeah, I mean, one of the reasons I think was I had to have that hard mirror conversation with myself and be like, am I a good player? Yeah, I'm a good player. But like, I also kind of knew deep down that if I were to play at the next level, even if it was overseas or maybe USL, right? Yeah. Or semi-pro team, like for me, I kind of had this weird innate gut feeling that it would be a lot of mental, emotional, physical work to be in a professional arena where maybe I would be average. And that was just the feeling I had. It was hard to explain at the time. Yeah. And like, I kind of just ran with it. And who knows, maybe I could have tried out for a USL team or tried overseas and maybe things would have turned around. But I kind of had that inner feeling that like, man, if I do this, like, I don't know if I'll be able to be better than average. And I hated that feeling.
Yeah.
Like I'd spent so much of my college career, and we can get into that too, but like a lot of my college career didn't have many highlights to it. It was actually a lot of disappointment and failure and picking myself back up and working through the struggle, so to speak. But I'm proud of that, like I'm proud to be able to say that. But I think it got to the point where I was like, okay, am I going to be making, to be honest, it wasn't a purely financial decision, but I was like, am I going to be making a lot of money as a pro soccer player coming out of undergrad? Probably not. Okay. Now that's not the biggest factor, but am I going to be like an above average player? Probably not. Like, okay, like it's starting to like become more and more clear.
Yeah.
And then I also had to dig deep in terms of having the conversation with myself and say like, why am I doing this? Like, why do I want to become a pro? Right. At the time. And when I really like spoke with, therapists about it and sports psychologists and, really clarified that my why at the time was like, well, I just really like working hard and being recognized for it. Right. But I think that wasn't a big enough why to like pursue a profession.
Sure.
You know what I mean? And kind of like what I alluded to before, like I feel like with physical therapy, it gave me an avenue where if I'm able to brighten the lamp for others, it would brighten my own path as well.
Yeah.
So to speak. And I just didn't have that same feeling deep down with professional soccer.
Yeah.
And then also the last thing I would say was during that time of me making that decision to transition away from soccer and kind of step away from the game, I kind of felt that, oh shoot, I lost my train of thought. This of course happens. Damn, I had a really fucking good point. Well, it'll come back to me, but it was God damn.
Yeah, let me throw this at you.
Yeah. It'll come back to me.
Yeah. Well, so I'll just say this, because in what we in the world of athletics, your value is like directly correlated with how good you are at something. You know what I'm saying?
Yes.
So like if like it's like whether you're a star player, a starter, a rotational player, a bench player.
Yeah.
Right? Your value is like directly correlated with your performance.
Mm-hmm.
You know what I'm saying? And then to a certain extent, even in like, I mean, definitely in the team sports setting, like even if you're a coach or a physical therapist or whatever it is in your team setting, it's still the same, because the stakes are, let's say in pro sports, because the stakes are so high.
Yeah.
You know what I'm saying? So like,
yes.
And that's why there's so much turnover in professional sports.
For sure. That actually reminds me of what I was going to say, is that sense of, I think, a little bit of control, right? Where in pro sports, it's more so about results. Like, can you get the results for the first team or not? I think when you're in the youth stages, it's more about development, or it should be, in my opinion.
Yeah.
Right. And then when you get to that professional level, you sign that contract. It's like, all right, like, can you execute? Can you be a good team player? Can you ask what's being asked of you? Right. And I think when I was analyzing my decision, at the time, I had this feeling that like maybe even if I did do really well, I'm still not in full control of like if I get traded, like potentially having to uproot a family. I mean, I have a lot of friends who play professionally now, and even a few that just retired, a few years after, signing a professional contract, and they're getting traded to different teams all over the US or elsewhere. Right. But that's a hard lifestyle sometimes, man, to be putting in that much sweat, blood, tears to be the best you can be at your craft. And then something that's out of your control to be like, hey, we're going to trade you for this other guy because we have different strategy or tactics, or this coaching staff is coming in and they're leaving, sometimes that shit just happens and it's just out of your control. And I think for me, like, I'm a little bit of a type A personality, and I think I didn't really love that idea. Like I preferred to be in a profession like physical therapy, where I get my doctorate degree, I continue to learn as much as I can as a professional to better add value to people. Yeah. And I get to dictate how I go about my business. Yeah. You know what I mean? Like,
that's interesting. It's interesting to have that foresight at that age, because like for me, when I decided to do what I wanted to do, and I was like, no, nothing is going to stop me. I'm going to make it to the league. I want to work in the NBA. So I like, whatever, I had tunnel vision, I did my thing. And then when I finally got there and I sacrificed all that I did just to uproot my life and move to the Midwest. Mm-hmm. And I realized like, this fucking sucks. Like, you know what I'm saying? Yeah. Like the job was the job. It was great. But like lifestyle and everything outside of work was like non-existent. You know what I'm saying? There was no life.
Totally. Yeah. And I think there's a flavor for everyone. You know what I mean? Like I know a lot of players I used to play with that after college, like they greeted those opportunities with open arms. Right. Like they kind of knew that like things weren't going to be fully in their control. Right. That, they may get playing time, they may not. That, they would have to earn a first team roster spot, that they might be put in, a random city that they're unfamiliar with and have no, family or friends. You know what I mean? Yeah. Some people didn't mind that. And, for those people, it's like, it's awesome. It's great. They're able to do it. For me, being really close with my family and having really strong roots here in Southern California, I didn't love that idea. Like I was willing to go to grad school outside of California and obviously do some rotations outside of, clinical rotations outside of California. But I always knew that I would come back and try to serve the community the best I could being back here. Yeah, exactly. So yeah, professional sports, it can be emotionally and mentally tough for people, especially if you have a family. So but listen, some people don't mind it. Yeah. So it's all good.
Yeah. Going back to collegiate sports, like, you have any? I know you talked about some challenges there. I mean, if you want to speak on some of those challenges.
Yeah, like, I could even take it back, like, through, if you want to get an even bigger lens of my collegiate experience, but we don't need to spend forever here. But
Yeah.
when I was playing in high school, I was playing at the LA Galaxy Academy. And at one point I was like captain of the team, and I was a center defender, and I was playing really well. It was probably the best I played in my youth career, playing really confident and having an impact on games and being a leader, which is like really what I enjoyed being, you know.
Yeah.
And at the time I was getting recruited by a lot of, you know, Division I programs, just because being at the LA Galaxy Academy, it kind of put me on that platform to be seen. And so at the time, a lot of people don't know this, but I was actually heavily recruited by Stanford. And my beginning of my junior year, like end of sophomore year, beginning of junior, I verbally committed to Stanford because they put me on an official tour. They had this huge scholarship lined up. It was like this awesome thing. And this is by no means to bash, you know, the Stanford program at the time or whatever. But what ended up happening was I verbally committed. Me and my family were super excited. Obviously, like being a 15, 16-year-old kid, like I'm telling my friends, I'm like feeling myself, puffed out chest a little bit. And there was like even a local newspaper that did an article about me going to Stanford, just because like, I don't know, I guess from my high school, like one of the first student athletes to verbally commit to a university like that, whatever. I don't really know. But there's an article about me, all these things. It was cool. And then a few weeks after I verbally committed, I get a call from the Stanford head coach, and I remember sitting in my room with my mom because I was just like, we were just chatting, and I was getting ready to go to soccer practice, and the Stanford head coach calls me, and he's like, hey, like, I hate to tell you this, but like, you didn't get in to the school. And I was like, well, what do you mean? Like, you asked me to get a certain SAT score, and I met that. And he's like, yeah, you did everything we asked of you, but we can't accept you. Like, admissions didn't accept you. Mind you, I had like a 3.9 GPA. I got the SAT score that they required for student athletes. It's kind of bizarre.
Yeah.
Right. And obviously threw me way off because, you know, I remember like.
Wait, so what happened?
So I couldn't go to Stanford.
No, but.
So what happened was.
Yeah, go ahead.
So what happened was, I mean, I broke down. I was crying. My mom was like, you know, also, I won't say nervous, but she was obviously, you know how Jewish moms are, feeling the heat a little bit. But you know, I was pretty emotionally like reactive and uncontrollable at the time because I was just like, I was pissed, I was depressed, I was like, what the heck, you know, like this was a huge opportunity. And so at the time, though, my head coach at the Galaxy Academy, great coach, name of Kenny Arena, he was the assistant coach at UCLA, and UCLA at the time was also recruiting me, but they weren't like heavily recruiting me. They were pretty much like, hey, we have a roster spot. What I was told is like, we have a roster spot. You're good enough to be here, but we can just offer you a roster spot. Like, we're not going to promise you any scholarship. We're not going to promise you any playing time. It's more of like, we would love for you to be here, and that's that. And at the time, UCLA was like number 1, number 2 in the nation, and Stanford was still in the top 5 or 6 in the nation. Yeah. But because of, you know, the going back and forth, I ultimately chose Stanford because larger scholarship. I felt more wanted there a little bit. But what happened when Stanford fell through, I spoke to my head coach, you know, at the Galaxy Academy, and pretty much we sorted it out. We're like, okay, well, I just made the decision. It was maybe a little bit of an emotional knee-jerk reaction. I was like, okay, well, I'm going to go to UCLA. And so that's what I did. In hindsight, you know, maybe I could have been less reactive, but I mean, for a 15, 16-year-old kid, that's hard to it's hard to control, you know what I mean? Yeah. Like maybe I could have paused and looked a little bit deeper into other programs that were recruiting me, other great schools. But I was really set on, at the time, for some reason, staying in California and playing for a really top school. So I went to UCLA, and you know, at UCLA, it was a phenomenal soccer program. We were top 1, number 2 in the nation. I developed a lot, which I really appreciate. The program was very professional. I met some lifelong friends and teammates there, which, like, thank God I did. But in terms of like playing time wise, you know, for a few seasons, you know, after my junior year, I was kind of like, okay, like, I love being a good teammate. I love developing, but like, again, maybe ego driven. I was like, I want more, you know, like I want to make an impact on the field a little bit more. And so then that's when I made the hard decision to, you know, although I loved the program there and I loved the school and loved my friends there, I made a hard decision to say like, okay, like I still want to try to go pro. Like I think I need to get more minutes under my belt and more playing experience.
Yeah.
So then that's when I transferred to Northwestern, and I think I underestimated the difficulty in that event, right? Like transferred to Northwestern, I got the opportunity to play, obviously different culture, but also like socially, like I'm coming in as like halfway through my junior year of college, like all my really close friends are back in UCLA, and coming into a new group that I just feel kind of isolated. Like I said, the soccer culture and I think mindset was a little different than what it was at UCLA. And that's nothing against Northwestern or the players there. It was just so different. You think about the weather.
Yeah.
It was just like a lot of, in my perspective, it was a lot of adversity and a lot of things that maybe I just underestimated.
Yeah, you
and
might
so
have overlooked a few things.
Yeah, like it made my ability to perform on the field, I think, that much harder, you know? So, you know, and like I said, like I'm grateful for the path I have, and I learned a lot about myself during that time. But, you know, after I graduated from Northwestern, it was just kind of like, okay, like again, and that's when I had that conversation with myself to say like, maybe I don't want to become a pro. Like, let's look deeper into why I'm doing what I'm doing.
Yeah.
But yeah, I mean, so I was kind of one of those examples where I didn't have like a ton of highlight reels, right? Like I was kind of more of the you know, really good teammate. You know, I probably was I sat on the bench more than I was on the field, really, in my college career. And you know what, like that's how it was.
Yeah.
You know, and I accept that now. I think a few years after, even, it was still hard for me to like wrap my head around that, but that's okay. Like that was my path, and you know, looking back, I have to kind of embrace that. And ultimately, I used all of that disappointment and quote unquote failure, I think, to fuel me to really go above and beyond in my professional life.
Yeah.
Which is why I'm grateful for it, because I feel like sometimes you have to go through some shit to really like to level up. You know what I mean?
No, absolutely, bro. You have to feel that, you know. Well, dope, bro. Well, I gotta go back real quick.
Yeah.
So, because I still don't know why. So you got the GPA requirement and the SAT requirement for Stanford, but
Correct.
why? But what happened? Like,
apparently admissions looked at my application and still denied me, even though the coaching staff said that like this is good to go.
There was no rationale. Like,
no.
It was just we
can't take you.
Right.
And like I said, that's no bash against Stanford or the staff or anything there, but at the time it was pretty alarming and pretty disappointing.
Yeah.
And I mean, yeah, to this day, I'll some people ask me about it, or even like ex-college coaches that I know or current coaches, and they're like, yeah, it's pretty messed up. But you know, again, it's sometimes in life there's stuff that's out of your control, man.
Sure.
It's really about like, how do you react to it, and what can I control?
Yeah,
you know, and you know, at the time it was hard to deal with as a 15, 16-year-old kid.
You have no foresight. You're just like,
yeah,
you're being led in this path. You're like, okay, this is it, you know?
Yeah.
Totally.
Yeah. So it's all good.
Yeah.
Yeah. Worked out.
For sure, bro. All right, moving on. We're going to talk about let's talk about physical therapy now, man.
Oh, let's do it.
All right, bro. So obviously you guys at Monarch, we've done such a good job of like just executing what we call.
Well, we have, Nate. I don't know about you, bro.
Sorry, I'm not there anymore. I'm an ex guy, ex-Monarch guy.
I'm totally pulling your leg.
It's hard for me to not say we. It's,
yeah, no.
You know, just
you're always be part of the family, man.
Yeah, thanks. So, anyways, I'll go with the physical therapy department has done such a good job of executing what you would call like a progressive physical therapy model.
For sure, yeah.
But like, before we talk about that, let's talk about like traditional physical therapy.
Sure.
You know, the things that like the general population is like aware of, and like, you know what I'm saying, and how you
yeah,
I keep saying how you like, you know, want to expose everyone else to what you think physical therapy really is and should be about.
Yeah, well, before I get into that, I just want to say that like, whether you look at it through the traditional lens or progressive lens, like, I don't think there's necessarily right or wrong, because I think at the end of the day, like, however you look at it, physical therapy can help someone, and there might be a certain strategy or approach that helps someone. And like, at the end of the day, as a physical therapist and healthcare clinician, like, I'm supportive of that. But to kind of answer your question, I think a little bit more of the traditional physical therapy model is mostly insurance based.
Right.
Right. And, you know, sometimes when I talk to new patients that I, you know, do evaluations for, or patients I've been working with, I'll ask them like, well, what were you doing before you got here? What's your previous physical therapy experience? And for the most part, again, I don't mean to bucket it into traditional progressive, but if you have limited experience with physical therapy, you might view it as, well, you know, I have this pain somewhere on my body from like a musculoskeletal standpoint. I go to my general physician, my doc, they write me a prescription, you know, to go see a physical therapist at a insurance-based clinic. And then from there, you know, they might do some manual work, some soft tissue massage, maybe cupping, other passive modalities. There's a lot out there now like ultrasound, shockwave, electric stem. And then, you know, they might show me, you know, 4 or 5 basic stretches or exercises without real like progression, so to speak. And then, you know, I might be working with a tech or an aide, you know, who usually is like a high school or college kid with minimal experience guiding you through your exercises or stretches or whatnot. So that's kind of like the traditional model is very more insurance focused.
Yeah.
But I will say, like, I think there's still a lot of very, very good clinicians out there who work in that type of model who are quote unquote more progressive, in my opinion. And also really, really great insurance models that really drive positive patient outcomes. You know, one of them is the Training House, who we've been talking about, like they were insurance based. Rehab to Perform's a top education company and physical therapy clinic. They have multiple clinics up in like the Maryland area. So it's not to say that like insurance model is purely traditional or like the past physical therapy.
Sure.
But I think there is a stigma that like physical therapy, it's these mundane stretches with bands, right?
Yeah.
Very simplified exercises with maybe some manual work, and then, you know, you're kind of shuttled to a lesser experienced tech or aide. So yeah, that's kind of like what most people would think of. And then if you dive deeper into it, it's sometimes people will say, well, like, you know, I saw my physical therapist for 15 minutes, right? And then I had to go work with this other tech or aide. Right. And I think in a lot of insurance models, and we can get into this, but, you know, the reimbursement rate from insurance companies to physical therapists is like shockingly low. So, and I get it from a business standpoint, right? You're trying to keep your lights on, you're trying to pay your employees. Like, you have to have a certain amount of revenue come through the door because insurance is only reimbursing so much, right? So it becomes this model where you're having, you know, sometimes 2 to 4 patients come in 1 hour that see a physical therapist because the reimbursement rate's low. But because of that, it's a high turnover, and in the physical therapy world, it's quote unquote like a mill. So it's multiple patients per hour. Right. And with that, you run the risk of maybe diluted quality of care. So I would say that might be more of like a traditional model. I think some patients can still benefit from it, so it's not to knock it completely. I think from a clinician standpoint that it's hard to work in that type of model for an extended period of time, because I think it's almost like, I heard the saying, but it's almost like death by 1,000 paper cuts if it's not an environment that is helping you grow as a clinician, that's kind of mundane, or, you know, not a ton of variety. So, I mean, and the amount of paperwork, by the way, too, for insurance-based practices is through the roof. So it's like not only you're working 40, maybe 50 hours a week, but you're also having hours of paperwork on the weekends, and it's hard. It's a lot to take on as a physical therapist. But like I said, you know, some clinicians thrive in that environment, and that's great.
Yeah.
Some patients do too, but we obviously do a little bit different approach at Monarch. Yeah.
I just mentioned that because, like, I'm not even a physical therapist, but the number of people I've seen come in through either people I've met through coming through the doors of Monarch, or just in life, just people like clients that I have or people that I've had conversations with.
Sure.
They'll just have like such disappointing stories, like whether it's like disappointing to me or like they're disappointed in the outcomes of their experience in physical therapy. It's like, damn, like I wish I could just like take you and just either take you myself and work with you, like because you're at a point where I feel comfortable working with you because
Sure.
you're at some like late stage, you're a late stage point,
rehab
point. Or it's like, hey, I need you to go meet this fucking person. You know what I'm saying? Like, you need to go work with Nati or whatever it is. You know what I'm saying? So it's just like, it breaks my heart to hear that, like, post-op ACL, you only did 12 sessions, and now they let you, you know what I'm saying? And now you're off, and you're trying to play basketball games. Like, no, you're not.
Ridiculous,
you know what I'm saying?
Yeah,
that's the stuff that like breaks my heart, you know?
Yeah, no, I think it's interesting. Sometimes a lot of insurance practices will like label themselves as like a sports clinic.
Right.
But like they have 20-pound dumbbells, like their highest weight, and you're like, do you know the demands of sport? Right. Exactly. You know, it's like that doesn't quite add up. But yeah, man, you see a lot of that. I think too sometimes, and maybe this is more of a traditional quote unquote perspective, and I think a lot of clinicians and a lot of initiatives are getting better at this in terms of like, I think it also comes down to communication. Yeah. Right. Like in school, we learn about different diagnoses and pathologies to better understand and study and compartmentalize different symptoms, right? So that we can learn about it and communicate it with other medical professionals. Right. But I think when we're communicating it to patients, it can be actually pretty harmful if I'm like, hey, you know, you have degenerative joint disease, like throwing that out, or
that sounds scary as hell.
Yeah, patellofemoral pain syndrome, right? The list goes on. IT band syndrome. It's like labeling syndromes and diseases for people who, at the end of the day, they just want to be helped. They want to know what's going on, why they're in pain, but then also like if we have the ability to help them get out of pain, right? And like what their goals are. Like these patients and athletes and general population clients, like they're still human. Like they just want to be able to do the shit they want to do. Yeah. So I think with that potentially harmful language comes this psychosocial aspect where you're like, oh, like you walk away from your physical therapy clinic sometimes like asking more questions than you came in with, and they're not like good questions. 100%. They're like, what's wrong with me? Like, oh my God, I have this syndrome. Like, and then you go on Dr. Google, and that's just a whole nother rabbit hole of negative, sometimes inaccurate information. Right. So yeah, I think, but luckily there's a lot of clinicians out there, including the ones we have at Monarch, as well as just in the physical therapy space in general, who very particular with how we communicate to patients to make it more of an empowering experience and trying to educate them of what's going on, but not planting thought viruses in their head, of like, hey, like this is what's going on, but it's okay. Like we'll be able to figure it out. This is, very common or whatever, and just trying to be an ally for them instead of like this being in a position of authority and telling them everything that's wrong with them. That doesn't help solve the problem.
You have this syndrome and you can't bend your spine, or you know what I'm saying, you have to live like a robot.
The worst is when I have a patient come in and they're like, well, my doctor told me that I have the spine of an 80-year-old, and it's like this like dude, he's in his mid-30s, and I'm like,
it's the least helpful information
ever. It's like, how does that make someone feel, man? Like that's pretty messed up. But
also, how is that helpful? Like,
it's not. No, it's just, I think in my opinion, it's kind of lazy. It's like a lazy way of trying to explain to someone, like in, trying to translate medical jargon into layman terms. Sure. Right. But it's lazy. It's like, no, like you just have normal, I like to think of it like example is like arthritis, right? Like I have arthritis. I'm like, okay, well, I like to think of that as like kind of wrinkles on the inside of your skin. Like sometimes that can happen a little younger, a little older, but that doesn't mean that like you're doomed. Like sometimes I'll use a lot of social proof as well, having some experience now and working with a handful of patients now for the past however many years. It's like, like I remember someone similar to you, and like they're doing great now. They're jumping, they're swimming, they're climbing mountains, they're hiking, whatever it is that they're doing now. They're back to sport fully, right? So I just think as a medical community, we need to hold a little bit higher standard of like how we communicate to our patients, because it makes a huge difference in their approach to rehab.
You just reminded me of something. It's like, I can't remember who told me this, but like this happened a couple times actually. So like they'll be like, oh yeah, I went to the doctor and they said like I have oh my God, I just lost it. a bulging disc or something.
Mm-hmm.
You're like, oh,
Yeah.
I have a bulging disc, so like I can't play basketball, or I can't squat or deadlift, or I can't lift weights, whatever it is.
Yeah.
And like, so I'll tell them a story. I'll be like, I'll talk about James Fay, like, or Naveed,
Yeah.
I don't even remember. I can't think of other clients that I've worked with who have had like, who were like properly, like, in the eyes of, in the eyes of the general public, like just on paper, like you're fucked. Like, you know what I'm saying?
Yeah.
Like,
the MRI comes and it's doomsday.
and you look at this and you're like, what the fuck? But like they presented, they were in a lot of pain to start, but now fast forward to now, right? And they're great. They're like, they're playing sports, they're lifting weights, they're doing all the things that they want to do.
Sure.
And that's all because of like what we were able to provide for them and guide them in an empowering like atmosphere, you know what I'm saying? And just do the right things, Yeah. So it's disappointing. That's all. Like the reason I brought it up is just because it's really disappointing to see that over and over again. And it makes me grateful to have worked with a team like ours over at Monarch because it showed me like, oh, this is the way it should be, right?
Sure.
So like, let's model the way we speak to our clients or our patients, the way we work with our clients, the way we communicate to them, and everything like that. This is how it should be done, because we've seen a lot of great outcomes out of it.
Totally. I have a funny story for you, but I had a patient, my first clinical rotation. So after my first year of grad school, we go into your first rotation, and it was an 8-week rotation and an outpatient clinic, very similar, insurance-based, kind of a mill style. I was up to a point I was seeing 4 patients an hour, which, to be totally transparent, as a student is actually not the worst thing because you're getting a lot of reps, right? So you're seeing a lot of different people and, seeing a lot of different pathologies and whatever. So as a student, it's actually quite helpful. But I remember I had this woman, she was like in her mid-60s, right? And she came in, she's, a little bit overweight, but really nice woman. But I remember I told her I was a student, that I'd be working with her that day. She's like, I don't want to work with a student. Like, I need to work with a professional. I'm like, okay, well, let me evaluate you. Let me see what I can do to help you. And we'll go from there. And if this is above my pay grade, so to speak, like I'll have my mentor work with you and he's going to be with us the whole time anyway. And it was funny because she was like, do you know, like, she was in a lot of back pain. She was like, I have shopping cart syndrome. And I'm like, I laughed because so in PT school, you learn that there's like this label, quote unquote, where when someone has, maybe if it's like spinal stenosis or let's say like extension based pain through the spine where it's hard to like stand upright, technically sometimes they might take what's called a shopping cart position where they're like hunched over like a shopping cart, holding a shopping cart. But apparently this physician or surgeon or whoever spoke with her told her she had shopping cart syndrome. And this lady was going around for like months from what she told me saying she had shopping cart syndrome and she's going to need surgery. And no one like cared enough to like educate her like, hey, like that's just kind of like a weird way of describing this symptom, but like that's not a real disease, And like I was laughing, but I also felt really bad 'cause it's like, oh shoot. So anyway, literally after the first session, I had her do some mobility stuff, some, exercise progressions, just kind of seeing what her baseline was. And we retested some positions and she felt like she started crying. She was like, this is the first time in months I felt any type of relief. Like, thank you so much. Yeah. And for me, I was a first year student. So it's not like I knew a ton, but I knew enough that I could be like, let me at least communicate with this person in a way that's helpful rather than just like stamping this, label or diagnosis onto them and letting them walk out the door. I still remember that woman to this day. I don't remember her name, to be totally honest, but that for me was a big learning moment of like the impact we can have just by doing things simply and by communicating a certain way. Like this woman broke down crying and it's like, that's how much it meant to her, right? And for me, it was a really touching moment because I was like, oh yeah, like this is why I'm in this profession. Like this is why, I chose to help people the way I do. So
yeah. And you obviously had that, like, you and I have had this conversation before of like building buy-in with patients is like creating that gotcha moment. That was obviously a gotcha moment for her.
For sure, yeah.
But like for patients, I'm sure you've had who have been more difficult, they've been more difficult because they have their own prejudices. Sure. They have, they have their own pessimism as it relates to their own health or whatever you're able to provide to them. But like, just creating that buy-in with like just a couple of things? Like, what are some of your go-to things to be like to create that moment?
Yeah, I mean, sometimes it happens maybe quicker with certain patients than others.
Right.
This is actually something I learned mostly from my mentor we mentioned earlier, Russ Linville, but he really kind of stamped it into my brain. But something I really like to use is this like Venn diagram in my head. And I think maybe we've talked about it before, but I kind of take, when I have someone who I'm trying to introduce to physical therapy, or, you know, maybe they come in with this preconceived notion of what physical therapy should be, or what works best for them. And like, I just, first off, I try to just say like, you know, hey, this is what's going on from my perspective. I try to ask a lot of questions like, you know, why do you feel this certain way? You know, what was your previous experience like? Like, what did you have success with before? What did you not have success with before? Like, I try to gain as much information by just asking non-harmful, non-judgmental questions. And then the way I approach it really, man, I try to not complicate it, but I try to take it from a perspective of like, okay, like what's the most evidence-based literature that supports like what this person's going through? Let's say low back pain, right? So that's number one. Number two would be what's my current experience like treating this, right? So I take that into account. And then number three is what's the patient preference, right? So I think about it in like a Venn diagram. Mm-hmm. And what's interesting is if you think about that, like that is going to be different for every patient that walks in the door.
Totally.
So if someone comes in, if I have two patients that come in with low back pain, one has a very strong patient preference of like what they want to do and how it should be, and one doesn't, like I'm going to obviously be treating them maybe slightly differently because I'm not a cookie cutter therapist, so to speak. Like I have to be kind of malleable to the person in front of me. But with people who have a strong preference, like I'll just try to educate them in a like non-threatening way of like, and we mentioned before, like social proof, like, hey, I remember it's really interesting you mentioned that. Like I actually just helped someone, you know, really similar symptoms like you, really similar experience like you. And now they're doing XYZ, you know, and I'll obviously be genuine about it. I'm not going to like make up some false patient. But I try to go about it that way. And like I said, sometimes it takes time for that buy-in. Sometimes it can be within one session that they're like, oh my gosh, wow, like I'm already feeling a lot better after me intervening with some strategies that I feel like are appropriate for that person. But listen, like let's say someone comes in and they're super hot on like manual therapy and they feel like they absolutely need manual therapy. Like, I don't know if I'm going to be like, fuck that, I'm not going to do manual therapy. I still have to cater to their preference a little bit. So I might still do some manual therapy for them just to kind of like scratch that itch, so to speak. And because I know if they there's also a lot of research that supports like if someone believes something is going to work, it's going to probably work. And that's where like the psychosocial aspect kind of comes into it. Yeah. So like for that example, like I might still use a little bit of manual therapy to help them. But while I'm doing it, I'm educating them about like, hey, if you want to get back to, you know, hiking more, if you want to get back to lifting weights or whatever their goals are, I try to have a cordial conversation of like, we have to be doing these things to prepare your body for that. Like I can't prepare you to squat a certain amount if that's your goal by like rubbing your back on the table. I have to have you squat, or I have to have you doing movements that incorporate hip flexion, knee flexion, right? Improving lower extremity strength, whatever it is. So I try to take it in that direction. And like I said, some patients it works really quickly. Some patients it takes a while. And listen, some patients it may not work at all. Yeah. And I've had a few of those as well. And maybe their beliefs are so strong and their preconceived notions are so adamant that they don't want to hear anything I have to say, in which case they go to somewhere else. And like, honestly, that's fine too. Yeah. You know, maybe they'll be able to find care elsewhere and like, that's fine. I'm not going to lose sleep over it. Like at the end of the day, I can say that like I did whatever I could to help them. And if they prefer someone else to help them, like by all means, it's all good.
Absolutely.
Yeah.
Yeah. You can't help everyone, you know?
Yeah, for sure.
Yeah. All right. Well, I know you to be like a really, really, like a really strong clinician. Like you're definitely one of the first people I think of when I have to refer, you know?
Appreciate that.
Yeah, of course, man. But like in terms of the industry of physical therapy, you know, obviously you're still, I don't know, how many years in are you? I would still.
In March, I'll officially be two years in. 2 years in. Yeah, I mean, not including clinical rotations that I did, because to be honest, like on clinical rotations, you are kind of working for free,
Yeah.
like with a mentor. But yeah, like officially after I passed my boards, it's coming up on 2 years.
Yeah.
Yeah.
So still really early in the game, man. But
Yeah.
I think you have a lot of potential to impact the industry. So, I mean, and I know you plan to. So tell me about that.
Yeah. Thank you. By the way, that's really kind.
Yeah.
You know, I try not to overthink it. I think like at the end of the day, you know, I wake up every morning and I kind of have this written affirmation list in my bathroom as I get ready. And it's like, today my goal is to like, can I add value to every person and environment I encounter, right? I try not to overcomplicate it. And I know with what I'm studying and, you know, projects I take on and things like that, that like if I go in with that service mindset of just trying to help out other people, even if it's one person a day, like for me, that makes enough impact in the industry, because that'll have a really strong, what we say, like domino or trickle effect, right? I think like moving forward, if I try to think, you know, more broad, like with my previous soccer experience, I think I have a lot to offer to the soccer community in general, right? Like whether it's from a sports performance side or injury rehab, or maybe a little bit blend of both. But I just think, you know, even if I didn't want to treat soccer players, like I couldn't avoid it, because I'm so heavily like rooted into the soccer community, and I have so many previous teammates, and know a lot of coaches, and you know, soccer's still very much a part of my identity, and it's like I just love the game so much. You know, so it's like I'm always going to have some soccer players on my schedule, but in terms of impacting the profession, I mean, as long as I do my due diligence of like trying to offer the best care possible for the person in front of me, trying to collaborate when necessary. I think also too, like one of the beautiful things about, you know, our relationship, and then also a lot of the strength coaches that I know both at Monarch and outside of Monarch, is the thought of collaboration, right? Like if there's something that I don't know with a patient, like I'd rather refer out and have them work with someone like you who might have more performance-based knowledge, right? And so at the end of the day, it's just like, how can I help as many people as humanly possible, right? And so, yeah, it'll be through patient care, through helping the soccer community. I think moving forward, I would love to explore like teaching opportunities. So kind of like trying to explore that right now, whether it's through grad school, you know, like local physical therapy programs that I can help, you know, lecture and help teach students, or even if it's just through my own online platform, so to speak, of providing programs or educational opportunities. But yeah, it's like, how can I help the patient in front of me? How can I learn from the people who came before me? And then how can I use every bit of knowledge I can to help the people coming behind me in the profession? You know what I mean? Because at the end of the day, it's to help the patient. It's not to like make myself the best therapist ever. Like, I don't care about that. I care about, you know, just like I said, adding value where I can. Yeah.
No, totally, man. Talking about soccer players, how'd you get involved with Calabasas, or just high school soccer anyway?
Well, it was actually funny. So, I mean, about late August, early fall, maybe September, I got a call. I mean, this is very random, but I got a call from the head coach from the varsity program at Calabasas High School for the boys program. And, you know, he was like, "Hey, is this Dr. Nati?" I'm like, "Yeah, what's up, man?" You know, he was pretty much talking like, "Hey, you know, I've heard your name thrown around a lot, you know, different professionals and athletes in the area, and we're in need of a strength and conditioning coach. And I know you see patients, but I also know you're a coach. And we would love to have a meeting with you to discuss, you know, maybe if there's some ways you can add value to our soccer program moving forward." And so that opportunity kind of came out of nowhere. I wasn't like actively applying anywhere to work in the high school system or anything like that. But what is interesting, so there's probably like, I would say like 6 or 7 players that play both like varsity and JV right now at the high school that I've been coaching soccer. Like as a soccer coach, I've been coaching since, you know, after I graduated from Northwestern.
Oh, wow.
So, I mean, these kids were probably like 10, 11 when I first started coaching them privately and in groups and things like that.
Coaching the sport.
Coaching the sport, yeah. I mean, and then once I got my CSCS, I would throw in some, maybe a little bit more like speed training or, conditioning or whatever, things that I was learning, as a young coach, but
Sure.
Mostly through just soccer coaching.
Yeah.
And so now these boys have developed and they're pretty good players. I'm not that I'm taking credit for it, but like they've worked really hard and they're good players, and most of them are on varsity, freshmen, sophomores right now. And I've grown really close with them and their families. So that was really nice. And I'm assuming that a lot of those players probably had a conversation with the coaching staff or other families in the area, and then my name popped up. So I had the coach reach out to me, which is super unique.
Yeah.
It doesn't happen a lot. I was really grateful for the opportunity, and we chatted, and coach seems like a really, thoughtful, intentional guy, which you love to see in a head coach. And was like, hey, he pretty much said to me like, hey man, we're trying to like up the professionalism of this program. We're trying to really raise the standard. I know he said like, I know you're a physical therapist working a lot, but if we could use your knowledge and some of your experience to help the boys get stronger in the gym, get them faster, build athleticism, whatever time of season we can find, then we'll roll with that. And I was like, cool, let's do it. I was kind of like, yeah, I would love to work with that, population. So, it was a cool opportunity that kind of came across my plate and took advantage of it.
That's dope, man.
Yeah.
Yeah. That's really cool. And I know how much you love soccer, obviously, so I'm sure it's great to be back involved with the game, because that's essentially what I'm doing with basketball, and it's really nice to be, involved.
Yeah, it brings you back to the love of the sport, right?
Yeah.
It's like sometimes I feel like a kid again watching these kids play.
Exactly.
It's like you're itching to like kind of play with them, but it makes you really appreciate the sport and like what the sport does. Like it just builds this community. It builds lifelong relationships, and you get to watch these athletes like achieve things that maybe they didn't know they could achieve before. And I mean that, like, as a leader, as someone in the space, like you can't put a price tag on that, right? So it's fun, man. It's a good time.
Hell yeah. All right, dude. We're gonna have some fun now. We're gonna move to the lightning round. So I'm gonna pick like 5 questions.
Landing the plane.
Yeah, that's
all right.
Let's
do it.
Pick like 5 questions. And obviously your answers can be as long or as short as you need them to be. Starting off with a good one. They're all good ones, but
give me the shitty ones.
Yeah.
I'm just kidding.
Who are your top 5 favorite artists, music artists?
Favorite music artists. Ooh, okay. Let's go with Kendrick Lamar.
Oh, okay.
The King. Let's go J. Cole. Speaking your language now. Let's go.
Yeah.
So yeah, Kendrick, J. Cole, Led Zeppelin.
Oh, nice.
Listened to them a lot as a kid. My dad was a huge fan, and like we would always listen to them in the car when I was younger, and I would listen to them in college a lot too, actually. So Led Zeppelin. Ooh, this is hard, man. It's a messed up question.
It's your list, bro.
I know. Joyner Lucas.
I knew that was coming.
Yeah, he's that guy's fire. Got one more. Honestly, I'm gonna take a slightly different route, but when I want to like slow down, Khalid.
Oh yeah.
Guy's the man.
Khalid's cool, bro.
Yeah, just he's a vibe. I really like listening to his stuff. So yeah, I'd say those probably right now are top 5. There's probably a few that I'm forgetting, and after we leave this podcast, I'm gonna be like, damn it, why didn't I say that person? But I'd say those top 5 right now.
All right, dope. All right, with that being said, what's an album, or you can give me 3 if you think of them, but let's say 1 to 3 albums you can listen to with no skips.
Like start to finish?
Start to finish, no skips,
like,
just let it roll. And you're like, damn, banger after banger, or whatever, bangers, but just whatever you're into.
Yeah. It's a tough one, man. Because it's funny, because I feel like I don't even listen to albums like start to finish.
Oh, really?
Not typically. I mean, sometimes if I'm listening to an album, like the song's whack, I'll just skip.
Yeah.
I won't really give it a chance, but I'll have to say Good Kid, Mad City.
Okay, that's a great
I
one.
mean, just the Kendrick's ability to tell a story, and his lyricism, and just, I mean, he's top notch. I actually met him.
No shit.
Right after college. Yeah, nicest guy in the world. Super cool dude. But so I think that's also why, like, I also appreciate him as a human, not just as a musician. But I'd say Good Kid, Mad City is up there for sure.
All right. Yeah, hell yeah. That's
I don't think I can think of any others, to be honest.
That's all right.
Yeah.
That's a powerful one right there. All right, dude, nice. All right, when things get tough, like where do you see yourself, or where do you draw your strength from? You know.
Good question. We can dive into this a little bit.
Sure.
I think about my lineage.
Okay.
So, quick story time. My great-grandfather on my dad's side, my dad's Israeli. My great-grandfather on my dad's side was, to my knowledge, he was in the Russian military.
Wow.
Early in the 1900s, and he was a lieutenant or sergeant. I don't know the exact title of his rank, but he was in the Russian military. And at the time, they were slaughtering and executing Jews, right? And they were going to random villages, and they were saying either you have to leave or we're going to kill you, right? Obviously, being Jewish myself, this story kind of, you'll see how it extracts a lot of like strength. But my great grandfather at the time was in the Russian military, but they didn't know he was Jewish. Like, he just kept that like under the table. So what he did was at the time, and obviously he wasn't going to go to these villages and slaughter his own people, he pretty much lied to his superior and said, hey, like, I'm going to go on a 2-week vacation with my family and I'm going to come back in a few weeks. And however it happened, they were like, okay, cool.
What the fuck?
Which seems like wild.
Yeah.
But essentially what happened was they escaped Russia, and like my grandfather was like smuggled in a coat out of Russia because they were like checking bags, they were checking children, they were separating families, they were killing, like, it was horrendous, right? And by the grace of God, like my lineage, my dad's side, they were able to escape Russia. Obviously, he lied and never went back to Russia after that, but that's when they migrated to what like present day Israel. And then from there, my dad's lineage was kind of like blossomed more. But I think about that sometimes in terms of my lineage, because it's like, one, when I'm going through a time of adversity, I kind of will think about that, like, okay, like what I'm going through right now is maybe tough, but no one's trying to like slaughter me and separate my family type of tough, right? Like, that gives me strength, because in a way I have this like self-conversation of like, okay, like I'm not supposed to be here, but I am. And I'm going to be doing whatever I can to represent my family and just show my ancestors like how grateful I am to be on this earth and to be a good member of the community and society and serve others and, build a healthy and happy family, all those things.
Yeah.
So long story short, I think really tough times of adversity, that's something that I draw to draw some strength. Also, like, I'll just work out really fucking hard. But being honest, like, I mean, that's sometimes the best way for me to get like out of my head and into my body. Yeah. Right. And I mean, you know how it is. Sometimes you just got to clear your head, and just a nice sweat will help a little bit. Yeah. Clear the air a little bit. But yeah, I would say those two strategies, I think I'll kind of draw strength from. No, it's amazing. Great strength. That was a great question. Yeah. It's hard.
That's a great way to draw perspective. It's a great story. Like, seriously. I mean, yeah, obviously I have roots that go to the first thing you think of is like the Holocaust.
For sure.
Always, So like, it's easy to like gain perspective when, like what you said, like what I'm going through is nothing compared to like what sure. My grandparents, even my parents, my dad was born in 1945. Like, he was born
the height of it. Yeah.
You know what I'm saying? In the height of it. And he was born in Iran. Like, Iran is it's not okay to be Jewish in Iran. You know what I'm saying?
Yeah,
and
for sure.
He was brought up in a part of Iran where like he got bullied and jumped and all the things because he was Jewish. You know what I'm saying? Yeah. And like, it's crazy to hear. I'll meet some of his friends and they'll tell me like, yeah, we all grew up in this town. We all fucking went through it. Like, yeah. Yeah. It's just fun.
Yeah, it's hard to wrap your head around, right?
Yeah.
But yeah, you said it. It's perspective.
Yeah.
It's like, well, whatever I'm going through, right? Like, how do I work through it or work around it, or what other perspective can I take to like be grateful in this moment and, learn from whatever I need to learn from.
Yeah.
And just kind of continue forward. It's the name of the game. But yeah, man, it's a good question. It's hard.
Yeah, no, of course. Actually, you know what? That reminded me of a story. I'm going to tell the story because actually I've been wanting to. I don't know why. actually been wanting to tell you this in particular, and I feel like you would resonate with this.
Yeah.
So I had a conversation with my friend's father, and this is actually regarding the same. Okay, this is why it came up. It was like regarding the same conversation. He's like, he talked about growing up in Iran, being Jewish. Is rough. And just like throughout Jewish history, like the persecution over and over, like world event after, you know what I'm saying? Like,
sure.
Dates back to ancient Babylon and Greece and whatever, Egypt and all the things, And fast forward to today, you got like, like the, I didn't even mean to bring this up, but it's like relevant now. But like, you have people talking about like the Jews control. This is like a fucking, the myth or like the saying is like the Jews control the banks and the Jews control Hollywood and whatever it is. And he's like, but anyways, so I say all that to say this is like, look, money is freedom. Mm-hmm. And that's all as a Jewish man and as Jewish people, that's all we've ever wanted is freedom. Mm-hmm. Freedom from the persecution, freedom from slavery, freedom from, et cetera, whatever it is. And money has been the tool to give us the power and the freedom to get away from all that sort of stuff.
Sure. Live the life that we want. Yeah.
Yeah, exactly. So like, in order for us to be free from that, we need to be successful at what we do.
Sure.
So, yes, that's why there are a lot of wealthy Jews.
Sure.
That's why there are a lot of wealthy Jews that work in Hollywood, that work in the banks, that whatever it is, like that fulfill the myths or whatever, you know what I'm saying, however the fuck you want to say it.
Yeah.
But like, we do that because we want to be free of persecution. We want to be free of racism, slavery, and all the other things. And it's crazy for me to, slapped me in the face. And I was like, holy shit! Like, I mean, I already wanted to be like great at what I do just for the sake of myself, but like this gives me a bigger purpose, and another perspective of like I never want to be in the pitfalls or fall in the pitfalls of like those things and be subject to those things just because I don't have the power or the freedom to do so.
Yeah, it reminds me of the quote by Maya Angelou where it's like, I come as one, but I stand as 10,000, right? And it's like, it's a way to honor the legacy, right? And honoring, all the stuff that our ancestors had to go through to get to this point. It's like you're saying, like, of course I'm going to do whatever I can to be successful, to set my family up in a position where it's not even a question that they have to deal with anything our ancestors had to deal with. Right. Again, it's that kind of perspective. And listen, there's always going to be good and bad people out there, regardless of race or ethnicity. It's just, it gets deep, but I totally agree, man. It's really the perspective you take and how do you want to set that legacy up for your family so that people hundreds of years can look back and be like, oh, like my great grandfather did that. Like he was a good member of society and helped other people. Like that is like what you can be proud of. You know what I mean? When you think about it from a bigger picture, right?
Absolutely.
Yeah.
All right. Next one. I feel like I already know the answer to this one, so I don't really want to ask it, but I'll ask it.
Why would you ask if you already know the answer?
I just hope I'm wrong.
All right. Well, okay.
All right. If you could relive one sporting event.
Argentina. I mean, okay, dude, let's pause for a second and just marvel at the God walking among men of Leo Messi. Because I know this was going there. No, if I could relive, okay, am I there like at the sporting event, or am I just like in the same time period?
No, any sporting event ever in the history of man.
Okay.
What, like
David and Goliath? No, I'm just kidding. Totally kidding.
Like, would you want? Yeah.
Ooh.
If you can relive that, whether you're watching on TV or whether you wished you could be there.
I mean, dude, if I could be like in Buenos Aires or I don't know if I personally would. I'm not going to go there. But like if I could be at the World Cup final, that would be pretty unreal. Like you saw like grown men crying at halftime of the Argentina-France game. That'd be pretty cool to watch that piece of history for sure. I think I'll keep it to the soccer community, but I think it was 2009 or 2010, where Barcelona beat Real Madrid like 5-0 and just absolutely smacked them. It was like in the height of Pep Guardiola's reign at Barcelona. And I remember watching that game on TV and just being so like in awe that, like, I mean, Real Madrid's obviously one of the best teams in the world, that this team literally just dismantled them like it was nothing. And like the ease, not the ease which they did it, but like they made it seem so effortless that that's how good they were at the time.
Yeah.
And it was really the start of like a new generation of soccer. So, I mean, that would be a really cool event to be at. I can't remember if it was at Real Madrid or in Barcelona, but either way, that would be a pretty cool, as a Barcelona fan, you know, since I was a kid, to relive that, just because like for a lot of Barcelona fans, that's like a big piece of history that like we hold a lot of pride in.
For sure.
I hate to say that knowing you're a Madrid fan, but
I knew that.
You knew it was going to do something with Messi.
Yeah,
exactly.
Yeah,
that's fair.
I knew it was
that's
Messi
fair.
involved.
Yeah.
So it's all good.
He's the GOAT.
You get to shine. It's all good. All right. Last one, man.
Okay.
Give me 3 people you look up to and why.
It's a good question. First one, I would say, well, I'm going to combine it. I would say my parents.
Sure.
But I look up to my parents, one, because they're like the definition of hard work and loving kindness. And I mean, they've showed constant support to me throughout my entire life, regardless of adversity that I was going through or life stage or decisions I made. You know, they've always been super supportive. So I look up to them, you know, as parents and as role models, you know, through thick and thin. So I would definitely say them. Another person I look up to, actually, I think he's technically a motivational speaker, but I love listening to Inky Johnson's stuff. Are you familiar with Inky Johnson?
I've heard that name. I think you've mentioned that name before.
So he's, long story short, but he's a motivational speaker, but he used to play football at University of Tennessee back in the day, had a career-ending injury where he had, you know, brachial plexus avulsion. So basically lost sensation and motor function in his right arm and hand.
Wow.
And I mean, he's just like the living embodiment of like solid principles, really good family man. I mean, makes a shit ton of money, more than he ever probably could have made as an NFL athlete at the time. But anyway, you should look into his story, Inky Johnson. But I really look up to him because I feel like he's someone who's gone through this really intense period of adversity, you know, through sport, and he came out of it victorious, right? And again, we're talking about perspective. Like he's the embodiment of that. Like, you know, he talks about just his ability to influence people and his family, and it's hard to explain in words, but I look up to him immensely. I think I listen to his podcast regularly, and he's just someone I always love listening to on YouTube or whatever platform I can listen to him. I draw a lot of motivation from him just because he's one of those people too who's like, he seems like a really humble guy, and you can just tell by the way he talks and acts, but he's also the embodiment of, you know, being a public success and also a private success. We talked about this before of like a lot of people, especially if they're famous, like they get into the rabbit hole of, you know, public success but private failure, right? For me, that's like one of my biggest fears in life.
Right.
You know? I mean, to be honest, I don't care to be famous by any means. I just want to be exceptional at my craft and help a lot of people, and I don't mind being well known within my community, but you know, fame's a different story. But he's someone who's private success and public success in terms of just like his impact. You should check him out. So Inky Johnson, I would definitely say someone I look up to. And then you know, I have a mentor of mine. His name's Will Humphreys. Super cool dude. I'm in a mentorship group with him once a month with a few other physical therapists. And he, again, embodiment of living life through principle, not necessarily like emotion. Really good family man. He's super open about his successes, his failures. He's, you know, bought and sold or grown and sold multiple physical therapy practices.
Wow.
So very successful businessman, but also just he operates in such a high standard of human, so to speak, like just an all around great guy. And for me to be in a mentorship group with him once a month, like every time I chat with him or meet with him, I always walk away from our conversations feeling inspired and grateful,
That's amazing.
And I feel like there's a lot of people actually outside of those three that I would love to also chat about, but I would say those are some of the main three right now in my life that I really look up to and, really get a lot of strength and knowledge and appreciation from. So, yeah.
Yeah, that's amazing, man. All right, dude. Well, your time to shine, man. Let me set you up. So, like, your opportunity to tell people what do you have going on? What's
tell
next?
The people.
What's next for you, bro? Like,
What's next?
What do you have going on now?
So I mean, we're building at Monarch. Super excited about it. Our department is growing, and we're onto some awesome things at Monarch Athletic Club. Opening our Brentwood location in I want to say January, February area, so later this month. For me personally, it's, continuing to help lead our department to, drive positive patient outcomes and exceptional service care. That's in terms of Monarch. I think personally, I'm going to continue to help out, local high school platform and help the strength and conditioning aspect for a lot of local soccer players. Shameless plug, but going to be dropping a website soon, so more people can communicate to me privately, whether it's for private, care or care that I can direct them towards Monarch, where we have a solid team of professionals to help them. Shameless plug, but it's going to be drnatidpt.com. So that'll be fun to launch in the next week or so. So keep an eye out for that. And then, like we mentioned before, but also going to be exploring a lot of teaching opportunities coming up. Right now, that's kind of our short-term kind of ideas that I have, and still in the process of hashing out long-term stuff. Yeah. But yeah, it's super exciting, man. Like, super grateful for it, and I'm very honored to be in a profession that I'm very fulfilled by, and that where I can help a lot of people, and I work with other like-minded professionals who truly give a shit, and like really enjoy helping people. So yeah, that for me is kind of what's next on the horizon, and if anything else comes up, I'll let you know for sure. But yeah, it's all good stuff, baby.
Dope. Well, shit, I appreciate you coming out, man.
Yeah, thankful to share the space, dude. Yeah, this is awesome. Thank you so much for having me.
Yeah, of course, bro.